Coming up, a woman is suffering from an accelerated heart rate, leaving her critically ill. The team arrived to find a man struggling for his life.
Post-cardiac arrest at the moment, so time-critical job.
And paramedic Barry Watkin is called to a 13-year-old boy who may have severed his spinal cord.
It leaves themselves?
Yeah, up at the top side at least.
In code 1. In Mission 1, the team are responding to a Status 1 emergency.
We're going to the Cleveland Horse Polo grounds. I believe there's cardiac arrest there.
55-year-old Mark Davis has suffered a major heart attack while playing polo. He has been revived by on-site ambulance staff and is now in a highly unstable condition. He is still at the scene, 9 minutes flying time southeast of Auckland in Clevedon.
We should only be about 5 minutes now from landing.
The team know the patient will need immediate medical intervention.
Hey, so Dino,
Yo,
keep turning and burning.
sure.
Post-cardiac arrest, probably hot loader.
Roger.
I just have some Metaramid on, but I'm ready for other things if we need it.
Is there ambulances there?
Got him.
Roger. So we're on the western side of those, over. Northcom, Westpac 2 now landing Clevedon.
Copy, Westpac 2.
Stay running, did I hear you?
Yes,
right?
please. So Dino, can you bring the stretcher, ventilator, and the portable O2?
Roger.
Both Chris and Russell arrived to find Mark in a critical condition.
Hi guys.
Hey, guys.
Hey.
He has fallen from his horse after suffering a major heart attack.
I'll get the vent set up.
Okay, I can take handover and start putting him on our machine.
Yeah, we'll get him on our monitor.
Yeah. So guys, if you're happy with the two, my name's Chris, I work with Russell. We'll just put him on our vent and away we go. I'm ready to take a handover.
Yeah, okay. So this gentleman was witness to possibly collapse and then fall from a horse. So when we got here, he's combative. He's had 0.4 of NAT with no result.
Okay.
Just couldn't manage his airway.
No problem.
This guy's post-cardiac arrest at the moment, so time-critical job. We're just getting him stabilised and then off to hospital.
Chris Denny knows time is running out for Mark.
Go ahead, Dean.
You going to Auckland?
I'll just put a quick call in and just find out where the cath lab is. I'll do that right now.
So he will make a call direct to ICU that could save his life.
Oh, hey, I just wanted a bit of advice. We're here in Clevedon with a guy post-cardiac arrest. He's now intubated and ventilated. Do you reckon we should come visit with you? Like, would you be able to activate the cath lab? Okay, that's fine. So that's what we're going to do. We're going to go to Auckland. Thanks for that, Mark. We'll see you probably 15, 20 minutes. Okay, thanks for your help.
It's now a matter of getting Mark to hospital fast.
So confirming again, heart rate is 94. I'll cycle a BP now.
Mark is struggling for his life, and only time will determine his outcome.
Connect them up, then we're all good to go. Thank you for that.
And hollow on ups
Roger, road RPM.
is 100%.
Talks.
No max.
In Mission 2, the crew are en route to a young man with a possible spinal injury.
Follow on up, checks complete.
Roger.
13-year-old Lewis has suffered an injury to his spine after a friendly game of rugby at school. Ambulance have called for support, 15 minutes flying time north of Auckland at Warkworth.
Ambulance have called us to respond to Maharangi College at Warkworth, and they've got a 13-year-old lad that suffered a neck injury during a game of sport, and they're querying that it may be significant, and they've requested helicopter transport. See the ambulance? In the middle of the field, you got the river?
Yes, yep.
To the right of the
Okay, and clear door now.
Right door's coming back?
Roger. Okay, just past the ambulance and stay on this left-hand side of it.
Roger that. At your discretion.
Okay, and clear out whenever you need to.
Roger.
Inside the ambulance, paramedic Barry Watkin takes a handover by an on-site ambulance officer.
It was originally said his pain was about 9 out of 10. I've given him 2 mgs of morphine and haven't gone any further with that. So
I got me back to you, Mum. Just been making sure I get the handover and make sure I hear everything.
It's no surprise that Lewis's mother is concerned for her son.
Now, Lewis, at the moment, you're sitting under a blanket, your feet are in full view there, and very gently and just slightly, you can just try lifting one leg, right hand, and then left hand for me. And stop if it's too sore or feels strange.
It feels strange.
And where does that feel strange? In the legs themselves?
Yeah, up at the top side of the legs, top up.
Okay, that's enough to...
In Mission 3...
We've been tasked to a 68-year-old female, I think it is, with, they're saying conscious VT, ventricular tachycardia, which is potentially a life-threatening problem when your heart's going extremely fast, usually around 200-odd beats a minute.
68-year-old Marie Yates is in a critical condition after her husband found her face down and unconscious. Marie is being stabilised by ambulance staff, 30 minutes flying time east of Auckland at the Whitianga airfield.
Radar RPM 100. Talk. Match. This check's complete.
Depending on her condition, there was a couple of lines of treatments we can do. One's with sedation and give her, an electric shock with the defibrillator to get her rhythm sorted out. One's with medication where we can slow the rate down, hopefully, and sort her out that way.
Whitianga traffic, Westpac Rescue 2, Big L 7 helicopter joining 22 Whitianga.
Harnesses
secure in the front.
We're also secure in the rear. There's checks complete.
Okay.
Ambulance is on the way, it's not here yet.
Oh, okay.
Hopefully they haven't stopped to do CPR.
So we just go in the usual place, right?
Affirmative.
I guess we'll shut down, Dave.
Yeah, we'll do that.
Till, yeah.
Okay, you clear out. I'll be shutting down.
Both Dr. Scott and advanced paramedic Marcel soon discover her condition may have worsened.
This is Marie. At approximately 16:30, Marie felt her heart racing. They waited about 15 minutes and her husband's called us. We've arrived. She's quite obviously distressed.
Has her blood pressure been okay throughout?
Her blood pressure has been okay. It was sitting at around 140. It's now around 160.
Okay.
And yeah, she's had a GCS lifting a long time, but was flaking out a bit.
What do you got it there?
The team must work fast to stabilise Marie before transport.
Just going to pop this on your finger, Marie.
What sort of history has she got?
What we've been told is hypertension and high cholesterol. Okay. She's on ditilazine, aspirin, and simvastatin.
Okay. Have you never had any problems with the rhythm of your heart before? No palpitations or irregular heartbeats? No heart attacks before or angina?
She's had an irregular narrow complex tachycardia, which hasn't responded to adenosine. And it looks like very fast AF.
Yeah, it does. It feels quite irregular.
And I think with the adenosine...
12 leads are right there.
Well, at some stage she's gone back into sinus rhythm.
Further results show that Marie's condition is of major concern, and she will need immediate treatment to control her accelerated heart rate.
She'll need monitoring and through to Waikato Hospital. Status 2. Still unstable.
In Clevedon, paramedic Russell Clark and Dr. Chris Denny are about to transport heart attack victim Mark Davis to Auckland's emergency department.
First blood pressure 185 and 136. Yep. We'll just need some sedation, I think. If we get going on the package, you must roll.
All right, let's go. We'll just set this and we'll split this.
Just before Mark is transported, his concerned mother, Alma, arrives.
Do you want to come with us, or do you want to?
Well, I don't think I can help.
Okay, no, okay, right. So you can follow.
I don't want to be a nuisance.
No, that's fine. Yep, no. So we've stabilised him at the moment.
Yeah.
Okay, he's obviously had a big heart attack.
Yeah.
All right. So, and we're going to take him to the hospital now.
Yeah.
And he'll get assessed there. Okay.
All right.
Just come to Auckland ED and then ask, and you'll be able to follow us. Okay.
If you want to manage the vent, I have a spare oxygen cylinder in the vent. I'm just going to go set up inside.
Okay, let's do that.
Gentleman's in his 60s, post-cardiac arrest with an excellent job by this land crew. Return of spontaneous circulation. Just going to package and get him going. we pre-alerted the emergency department and the cath lab so we can get going as fast as we can. We're ready to load.
Okay, Chris.
Okay, I'm just gonna get the inside.
Just head towards the crewman.
Secure on the rear. Thank you. Instruments are all good, there's no flags.
Roger, check's complete.
In terms of numbers, are you happy? Numbers, yeah, it's a little bit hypertensive at 151, 109.
Okay. Roger, comms, Westpac 2.
Westpac 2.
Roger, we've lifted for Auckland Hospital, we've got 6 POB, patient status 1, ETA of 1233.
Copy, Westpac 2.
So we want to keep this gentleman as comfortable as we can. He's now intubated for his protection, and we're just preparing to offload with some speed. Our worry is, of course, this poor gentleman's had a heart attack, so if we can get his arteries open, again, we'll reassess him as soon as we get to the hospital, but that's our plan.
At Mahurangi College, paramedic Barry Watkin is preparing to transport 13-year-old Lewis to hospital after he was involved in a rugby accident.
Just all we're going to do is essentially transfer from that scoop in there onto here, unclip it and give it back to the ambos. And he's on our scoop for transfer to the hospital.
Barry's main concern is that he may have a spinal injury.
Now there's a little gizmo here to bring across. Lewis, if this is too tight, you tell me to say, hey, that's enough. Because there's always potential for, without much in the way of symptoms, you can still certainly have an injury. So treating carefully is appropriate. And we had a nice quick trip to the hospital and reasonably smooth.
It's now up to the team to get Lewis to a waiting medical staff at Auckland's emergency unit.
Down, blow it, and blow it. Cool. We'll go around to the front.
Closing door.
Roger.
Road RPM.
100% and coming up a bit.
Talks.
Talks are matched.
Annunciators.
We're all out.
Top lineup checks complete.
Roger.
Young Lewis took a hard blow from the knee on the chin, treated as a spinal injury and packaged accordingly, and hopefully X-ray will reveal nothing major's happened. Northcom, Westpac Rescue 2.
Westpac 2, go ahead.
We have 6 POV and 1 status 2. ETA there is 6 minutes past 3. Over.
Are you guys setting the back?
Yeah, good. Unilever's all on as well. Thank you.
Finally, Lewis is delivered to Auckland Hospital, where he will be assessed to establish the seriousness of his injuries. At Whitianga, paramedic Marcel and Dr. Scott are very concerned about their patient, Marie. She is suffering an accelerated heart rate and is now at risk of going into cardiac arrest. A local doctor was first at the scene.
This is a 68-year-old lady with no previous history of heart problems apart from high blood pressure, and she's gone into a very fast cardiac rhythm, which has given her some chest pain because the heart's racing so fast. And we've tried to use some drugs to try and slow the heart rate down, only partially successfully so far. So she needs to be in hospital for more definitive treatment.
Which means Marie will need to be transported fast to hospital.
The worst case scenario in transit in particular would be her heart going very fast again and her blood pressure dropping, and if that was the case we'd actually have to give her an electric shock to the chest in flight.
It's a very concerning time for Marie.
All right, a couple of bumps and things as the stretcher comes out, but you're safe there.
The rescue crew try to comfort her as much as they can before transport.
Go on 3. Yep, 1, 2, 3. And up. Yep, awesome, perfect. All right, love? How are you feeling right at the moment?
Okay.
What are you feeling?
Marie is still dazed and confused.
If you get any pain, any shortness of breath or any discomfort, tightness, heaviness, anything like that in your chest, you let us know. All right, we're just going to wheel you to the helicopter and you're cold. OK, let's get you in there and get you warmed up. Come on, I'll even put a blanket on you. I've got a nice heat blanket. 1, 2, 3. Yours, Dean.
Marie's husband, Dave, will be accompanying her to hospital.
Is that hers, is it? I'll give you that. Yours? Cool, look. So just confirming Waikato, Dave?
Yeah, no worries.
Yep, cheers.
35 minutes.
Thank you.
Set and secure. Roger that.
Marie was enjoying a holiday with her husband in Whitianga, and she was just doing some knitting apparently when she suddenly got this racing heart, some chest pain and feeling terrible. Anywhere between 150 and 200, so it's still running much faster than normal. Normal is sort of between 60 and 100. She's still status 2, serious. She's stable at this time, but has the potential to deteriorate, but hopefully she'll stay as she is and carry on. We'll get her to Waikato okay.
En route to Waikato Hospital is 68-year-old Marie. She is still in a critical condition after her husband Dave found her lying down and unresponsive.
The thing we'd be worried about in this setting would be if her heart went fast enough to cause ischemia. There's not enough blood, and that would be present in the setting of her getting chest pain again. So if her heart rate was going faster again and she was becoming more unwell, we would probably treat her initially with some more medication to slow the heart down. And if that wasn't effective, we would be forced to give her an electric shock to the chest, which is a fairly dramatic thing to do in flight, so to be avoided if possible.
It's no surprise that Dave is very concerned about his wife, Marie.
We've got Marie's husband Dave on board as well. He's obviously pretty concerned about her, and it's obviously part of our job is reassuring him that we're doing the best we can for Marie and that she's going to be okay.
But within moments, there's a problem. She's having further complications with her heart.
Marie's just become a bit more unwell with nausea and vomiting. It's not uncommon to have nausea in the setting of arrhythmias and chest pain. So we're giving her some medication to hopefully get her feeling a bit better and settle her vomiting down.
Fortunately for Dave and his wife Marie, the Code 1 team are on their final approach into Waikato.
Rotor RPM 100. Talk. Match. Enunciators clear. This check's complete.
Westpac 2 landed at Waikato Hospital, over.
Marie's made it to hospital uneventfully. She was a bit sick on the way over. I think her heart rate's jumped up again just as we've arrived, so she may need some more treatment in the short term for that. And I think she's probably going to be in hospital for several days figuring out why this has happened and potentially having some treatment started to prevent it happening again. But all in all, she did pretty well there, and I think there would have been quite a few things that could have gone wrong there that we managed to avoid through luck more than anything else. And I think the medication that her doctor gave her at the scene before she flew was probably actually a good thing. That slowed her heart rate down enough to give us a window to get her to hospital pretty uneventfully, so that was good.
En route to Auckland Hospital is critically ill Mark Davis. He has suffered a major heart attack while playing polo.
Auckland AD, this is Westpac Rescue 2. How do you read, over?
Loud and clear.
Roger, we're coming to you today from Clevedon. We have on board a 55-year-old male. His chief complaint is post-cardiac arrest. He's currently status 1. He is intubated, sedated and ventilated. ETA, your department is 6 minutes, over.
We'll see you in recess.
Roger that, see you in recess. Westpac Rescue 2 out.
So at this point, when somebody has a sudden collapse, we often worry about a vascular problem. And what we weren't sure is whether this was related to a brain injury or in fact to a heart problem. So whether it's a heart attack or a dysrhythmia. So that's why we chose to bring him to a center of excellence that can look after both. My suggestion would be that we take the yellow scoop here and then we'll just bring him over in one lift, if that's all right. We were wondering whether he might be having an acute coronary syndrome or a heart attack, but keeping an open mind that he'd fallen off his horse and could have injured his head. So we think probably one of those two.
4 months on, professional polo player Mark Davis is still making a slow recovery from his injuries. He only remembers parts of that day the incident happened.
I remember what the game was. It was just it was a practice game, a tournament game that we needed to win. We needed to win. They needed to win.
Due to the damage suffered to his brain, Mark struggles daily.
When it first happened, I couldn't remember much. And now I remember a fair bit. Yeah, I remember that I lost the use of my right arm and leg. Yeah, and I suffered from memory loss. It's no, it's not completely come back, but I hope it will. You know.
And he knows it will take some time before he's back on the horse.
So Polo, I guess, is going to have to stop and see how much fitness I can get back. You know, that'll tell you.
Since the accident, Mark's reminded daily how lucky he was.
Apparently, a helicopter got there, and I had to get on there. I'd flatlined.
Thankfully for him, all the rescue staff were able to bring him back to life during the flight to hospital.
They just happy to be alive, really.
Marie was under observation overnight and received medication to control her heart rate. She is now doing well back at home. Lewis was released from hospital with a bruised spine and is back playing rugby. Mark Davis will never forget those that helped save his life.
If the helicopter wasn't there, and they were things were staged differently with their job, I mightn't be here, you know. Just mightn't be here.